There we go. There we go. Good morning and welcome to the Caregiver Teleconnection sessions. My name is Minerva Villarreal, and I will be your facilitator for today's session. And we will be covering what you need to know about medications, the benefits and the risks for seniors and caregivers. Before we get started, let me tell you a little bit about our presenter, Lucy Barylak. Lucy received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-standing manager of the Caregiver Support Center at the CLSC Rene Cassin, a multi-service respite program for family caregivers, and oversaw transference of knowledge for programs including caregiving, mental health, elder abuse, and palliative care. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association, an award on the basis of her dedication in developing a national coalition to support the issues and challenges facing informal caregivers. Ms. Barylak also co-edited a book on caregiving issues entitled Responding Creatively to the Needs of Caregivers, a resource for healthcare professionals, published by Edition St. Martin. In 2018, she was author to a chapter in Marguerite's Place, Minister of Seniors in Quebec, and Rosette Parr's book titled De la Proche Aidance la Bienveillance, published by Marcel Bouquet. She has been a key architect of screening and assessment tools for family caregivers, and she provides training for healthcare professionals across North America on the use of these tools. Lucy is also a consultant for private industries, which include work with the Wellman Charitable Foundation and clinics in Texas. Lucy would also like to let you know that she was also a caregiver to her mother. And with that, take it away, Lucy.
Thank you so much, everybody. Good morning and welcome. Just a little quick reminder, we're going to have a bit of a quiz later on. So if you have a paper and a pencil or a pen handy, just take a few minutes to get it. I will be presenting my session and then you will have an opportunity to ask questions. So what I'm talking about today is what you need to know about medications, the benefits and the risks for seniors and caregivers. What I want to say is modern medicine has contributed to a longer lifespan, improved health, and better quality of life. Medications are the most common treatment for many diseases and conditions seen in older people and people with disabilities. Medicines now not only treat and cure disease that were untreatable many years ago, but they aid in the early diagnosis of disease, prevent life-threatening illnesses, relieve pain and suffering, and allow people with terminal illness to live more comfortably during their last days. However, for older adults and people with disabilities, medications, either prescription, over-the-counter, social drugs such as alcohol, even herbal remedies, alternative medicine, can be a double-edged sword. When not used appropriately, effectively, and safely, medications can have devastating consequences. The changes that occur with aging and disability makes people more likely to suffer medication-related problems. Nevertheless, research has shown that medication-related problems are often preventable. Caregivers can play a key role in helping to identify what an actual potential problem can occur. This assistance can help prevent the costly and unwanted negative consequences of medication use, such as admission to hospital, assisted living facilities, or even nursing homes. And about 1/4 of all nursing home admissions are due, at least in part, in the inability to take medications correctly. So that is really a reality check. That is why I believe that we all need to educate ourselves regarding all forms of medication. Next slide, please. Thank you. So let's look at the topics that I will be discussing today. I'm going to touch on dementia because that's really important because people with dementia sometimes take a lot of medication. I'm going to talk about what are medications and possible side effects, common mistakes when using medications and the risk of falls for seniors. That's a big issue. And pharmacists are your best friends. So we'll go to the next slide, please. Okay, so dementia. So we know that dementia is a chronic, but before I talk about that, I do want to explain. People use the word dementia very often, but what dementia is an umbrella for many diseases. And it's very important to have the right diagnosis. So under dementia, there could be Alzheimer's, Lewy body, vascular dementia, frontal temporal dementia, and even Parkinson's fits into that. So dementia is just the umbrella for many diseases. It is a chronic, progressive, and you kind of cannot change it. It continues to become worse as time goes on. There's deterioration in cognitive functioning. They don't remember things that they did maybe 5 minutes ago. There's inability to process thought, affects memory, thinking, orientation, comprehension, calculation, learning capacities, language, and even judgment. So if a person has dementia and is displaying any sign of side effects like dizziness or drowsiness, the chances are they can't use good judgment in the home or outside. As well, the medication side effects may increase their confusion and behavior. For example, if they're trying to get out of a chair, pardon me, and feel drowsy or dizzy, they may not have the good judgment to sit back down, but they get up and they may fall. Now, research tells us that the number of types of drugs prescribed to seniors changed very little since 2011 to 2016. In 2016, seniors were prescribed an average of 6.9 different drugs over the year, compared with 7.1 in 2011. Approximately 1/4 of seniors were prescribed 10 or more different drugs each year. So cardiovascular drugs for any heart issues made up 5 of the top 10 most commonly prescribed drugs. So the number of drugs being prescribed to seniors was the factor most responsible for hospitalization related to adverse drug reaction. That means there was a reaction. Seniors prescribed 10 to 14 drugs were over 5 times more likely to be hospitalized than seniors prescribed between 1 and 4 drugs. So these are really things to think about how many drugs a person is taking. So according to the CDC Center for Disease Control and Prevention report of November 2020, older adults 65 years or older visit emergency departments almost 450,000 times each year, more than twice as often as younger persons. So older adults are really 7 times more likely than younger persons to be hospitalized after an emergency visit. But most of these hospitalizations are due to just a few drugs that should be monitored carefully to prevent problems. And those drugs are blood thinners, drugs for diabetes, seizure medication, and prescribed opioids are some of the examples of the medications you should really be aware of. What they are saying is that we need to keep in mind that medicine, either prescribed or over the counter, has the potential to improve health and well-being. Many people, including older adults, depend on medicine to provide relief, control their medical conditions, and help them lead normal, active, or independent lives. But when not taken properly, it can sometimes cause other health-related problems. So I'm not trying to frighten any of you, but it's really important to keep in mind that medications can actually have, they are a double-edged sword. Let's go to the next slide, please. So when I talk about medications, what exactly do I mean by medication? So obviously it's prescription given by a doctor. Over-the-counter medications are considered medications as well. So if you can't sleep or you have a cold, you pick up these medications. I have to tell you, they are considered part of the problems as well. Natural products, herbal, vitamins, organic products, all of these things have got to, your doctor and pharmacist needs to know everything that you or the person is taking. So just keep in mind that medicine can come in the form of tablets, capsules, pills, liquids, puffers, inhalers, cream, patches, drops, needles, suppositories, and even ointments. So when we talk about what are medications, that's exactly what the doctors and pharmacists need to know. Next, please. I want to talk about side effects. All right, so these are some of the side effects that you might expect if you're taking medications or the person that you're caring for. For example, there's dizziness, which can cause falling. Mental confusion, what I mean by that, there seem to be more confused than they were before, or someone who's not that confused is becoming more confused. Dehydration definitely causes more confusion. There could be diarrhea, constipation, rapid heartbeat, sweating, pain that was never there before in the joints, aggressive behavior, believe it or not, their personality changes, and it could boost sex drive as well. So some side effects can go away, some are expected, and others are only identified when you do some either blood test or any other form of testing. So if you think someone is having a bad reaction, especially if there's a new medication the person was prescribed, call the pharmacist immediately and they'll let you know, or worst case scenario, you might have to go to the hospital. So these are important things to keep in mind. Next slide, please. You know, I want to tell you that older adults often have several medical conditions. We know that. These conditions may affect how the medications works in the body. Medication used to treat one condition may also make another condition worse. For example, older adults with memory problems may have worse symptoms due to the medications they take to treat other conditions, like maybe a heart condition. So each healthcare professional needs to know about all the medical conditions and related medicines that the person is taking. Your healthcare professional also needs to know if the medications make any of your condition worse. So let's look at the slide. As we get older, our bodies react to drugs differently than when we were younger. The aging process can actually affect how the medication is absorbed in the body, and it takes longer to flush out of your body. That's why they tell you to drink a lot of water. Change that decreases your body's ability to break down or remove certain medications from your system may mean the medication can stay in your body longer. Okay, so these are all the reactions that could possibly happen. Next slide. This is a very important thing to really be very, very mindful of. Following routine and finishing medicine. Even if a person feels better, it's important to finish all the medicine, or the sickness can occur, especially with antibiotics. I know I've taken antibiotics myself in the past, and it seems that after a couple of days, you kind of feel better, and you say, okay, maybe I'll stop, I'll keep it for another time. You cannot do that. You have to finish your medication. Some medicine must be taken at certain times in order to ensure the correct amount is in your body and that it works as long as possible. If you forget to take a medication, just call your pharmacist. They'll tell you whether you should just skip one dose or take it as soon as possible. And it's always have a list of your medication in your possession, and especially in your house. it's important to keep it in case there's an emergency and you have to call 911. It's important for them to see all the meds that the person or you are on. And of course, always carry your medications wherever you go because you never know what's happening. Next slide, please. Now, I do want to talk about the effects of food and beverages on medications. Medications may be affected by the foods, drinks, supplement, or herbal products or other medications that you take. For example, we decide to take a herbal tea because it seems it's going to calm us. There could be a reaction, so it's important to know as much information as possible. So, for example, some antibiotics are not absorbed well when taken with foods, drinks, or medicines that contain calcium, magnesium, or iron, antacid, vitamins, or dairy products contain these, okay? Also, certain drinks such as grapefruit juice can change how your body processes the medications. These changes can cause the medicine to build up in your body. You can ask your pharmacist about what foods, drinks, or supplements, herbals to really avoid when you pick up your medication. The pharmacist needs to, to know as well. Let them know all the medications that you're taking over the counter, especially if it's medications to sleep or if you've had a cold. Always read the information sheet that you receive at the pharmacy. Certain medications can also boost someone's sex drive or cause aggressive behaviors, especially for someone suffering from dementia. If a loved one suddenly starts behaving inappropriately, sexually, verbally, or physically, it's time to call the doctor. Explain to the doctor what is happening. Keep in mind that the behavior may be caused by certain medications or physical problems like an infection that you're not aware of. They could have a urinary tract infection, which will definitely change their behavior. So when going to the doctor, bring all the medications with you, prescription, over-the-counter, vitamins, supplements, etc. I'm going to keep saying that over and over again because it is so, so important. Let's go to the next slide. So here it is, safe storage of medication, all right? It's important to keep that in mind. Do not store medicine in the bathroom, all right, even though you have a medicine cabinet there, or the kitchen, because they can be affected by dampness and heat. Do not store medicine in any place that is too warm, like near a stove, heater, or in the sun. The best place to store medicine is in a cool, dark, dry, and secure place, such as a bedroom. Note that some medication has to be kept in the refrigerator, so obviously you're going to do that. To minimize the number of times that the bottles, minimize it, or the vials are open to reduce exposure to moisture. So weekly pill reminder boxes are great and they can certainly help. Try to keep all your medications together for convenience and keep medicine away, obviously, from children and from pets. Next, please. So I wanted to, no, I think we skipped one. Can we go back? Okay, can we move forward? One. Okay, thank you. Medication and the risk of falling. So why am I talking about that? Because remember in the beginning, I talked about the fact that medication can make you dizzy and that falls are really something that we have to be careful about. So again, I'm going over it again. Any drug that causes the following can increase a risk of falling. So if the person is dizzy, drowsy, hypertension, meaning low blood pressure, Parkinson, any kind of shaking, poor mobility, the gait is off, you don't, the person doesn't have muscle control, causes clumsiness, involuntary movement, vision disturbance, not seeing well, double vision. Any drug that causes the following can definitely increase the risk of serious outcome in an individual of falling. So if there are falls, it could be osteoporosis or reduced bone mineral density. It increases the risk of fractures if you fall, bleeding risks, you can have hemorrhaging. So all are the things that we really, really want to avoid. Next, please. So here are some interesting statistics. Each year, and this is from the CDC 2024, so it's extremely recent. Each year, millions of older people, those 65 and older, fall. In fact, more than 1 out of 4 older people falls each year, but less than half tell their doctors, okay? Falling once doubles your chance of falling again. So that's important to keep in mind. Next, please. So according to the University of Buffalo in 2021, and from 1999 to 2017, more than 7.8 billion fall risks increasing drugs were prescribed to older adults. That means they knew that these medications could cause increase the falls and dizziness, but they had no choice. They had to give them because of the disease that the person was actually having. And the deaths from the falls actually doubled. Next, please. Now, the falls among older adults are public health concerned worldwide, according to the World Health Organization. About, a third of older adults fall each year. The percentage ranges from 32 to 42% for those 70 years or older. Next, please. So I really want to talk to you about, are you at risk for falls or the person that you are taking care of? Fall remains the leading cause of injury relating to hospitalization among seniors, and between 20 to 30% of seniors fall each year. So here are some surprising facts and statistics related to seniors and falling. 87% of all fractures in elderly are due to falls. 2/3 of them who fall will do so again within 6 months. When an older person falls, his or her hospital stays are almost twice as long as those of older adults who are admitted for any other reason. Among people aged 65 to 69, one out of every 200 falls results in a hip fracture. That number increases to 1 out of every 10 for those aged 85 and older. 1/4 of seniors who fracture a hip from a fall will die within 6 months of the injury. Many falls do not result in injury, yet 47% of non-injured seniors who fall cannot get up without assistance. For seniors who fall and are unable to get up on their own, the period of time spent immobile, like on the floor, often affects their health outcomes. Muscle cells breaks down to occur within only 30 to 60 minutes if you're lying there and can't get up, of compression due to the fall. Dehydration, pressure sores, hypertension, and pneumonia are other complications that can result. Falls or without injury also carry a heavy quality of life impact. A growing number of older adults fear falling and as a result limit their activities and social engagements. This can result in a further physical decline, depression, social isolation, and feeling of helplessness. The most profound effect of fall is the loss of independent living. So if we go now to the slide, ask yourself, have you or your loved one had a slip, trip, near fall, or fall in the last 6 months? Are you or your loved one taking a drug that can cause side effects, such as dizziness, difficult to walk? Are you or your loved one taking a high dose of drugs, many drugs? Are you or your loved one over the age of 65? If yes, patients may be more sensitive to these drugs because it's changes in the way the body absorbs them. And I spoke about that. Are you or your loved one taking more than one drug that increases the falls of risk. Are you or your loved one at high risk of falling for other non-related reasons? Maybe it's poor mortality. You're using a cane or a walker and you might not be using it properly. Is it difficult for you or your doctor to monitor for any of these side effects? Does your loved one suffer from any form of dementia and they're definitely at risk for falling? Next slide, please. Now, this is a little quiz that I wanted to take, and I hope that you have a little paper and a pencil. It's very easy. If you want to do more of it on your own, you can receive the slides and you can do it a little bit more in depth once you have them. I'm only going to read the ones on the left side, asking you, have you fallen in the past year? What I want you to do is actually score yourself or the person that you're caring for. So every time you say yes, give yourself 1 point. So let's start. I have fallen in the past year. I use or have been advised to use a cane or a walker to get around safely. Sometimes I feel unsteady when I'm walking. So if you say yes, give yourself a point. I steady myself by holding onto furniture when walking at home. I'm worried about falling. I push with my hands to stand up from a chair. Okay? So if you gave yourself a yes for any of these, keep the score. Let's go to the next slide. Okay, then we're continuing. I have some trouble stepping up onto a curb or going down to a curb. I often have to rush to the toilet. If that's the case, give yourself a point. I have lost some feelings in my feet, and that can happen as we age. I take medications that sometimes makes me feel lightheaded or more tired than usual. I take medications to help me sleep or improve my mood. I often feel sad or depressed. All right. Now that you've scored yourself, add all the scores together. Now look on your right-hand side where it's kind of showing blue. If you scored 4 points or more, you may be at risk. Talk to your doctor or healthcare provider about any questions that you may have. So it's really very easy to get 4 points, so it's kind of scary. So if you scored more than 4 points, please let your doctor know and the pharmacist and take action of how to remedy some of that. Okay, so I have to say that let's look at some tips to avoid falls. So we can go to the next slide. A study in March 2021 at the University of Buffalo found that 94% of older adults prescribed drugs that raise the risk of falling. It's a known fact. The study found that the percentage of adults 65 and older who were prescribed a fall risk drug climbed to 94% in 2017, a significant leap from 57% in 1999. The research also revealed that the rate of death caused by falls in older adults more than doubled during the same period. So because seniors take more medications than the younger population, they are more at risk for the side effects and falls. When you get a new prescription, ask the doctor and the pharmacist if this drug has a side effect of possible becoming dizzy, sleepy, drowsy, or forgetful, which can escalate a potential fall. So people who suffer from any form of dementia and are taking prescription medication as well as over-the-counter medication are at a higher level at risk for falls. So let's take a look at tips of what you can do, okay? So it says falls are the main reason older adults fall and lose their independence. So the first thing is be active. Now, what do I mean by that? Daily activities can give you the balance, strength, and flexibility you need to stay healthy. Before you do any exercises or the person you're caring for, please make sure to ask the doctor. Now, when I talk about exercise, you don't have to join a gym. You can do very easy exercises in a chair. There are amazing videos for seniors, exercises in a chair, and they're totally free. Walking is amazing. Okay. And also just doing things around the house that keep you safe. So being active, I cannot emphasize enough what that means for your balance. Again, all that I was saying, use medication wisely. Medication can affect your balance. Review medication with your healthcare provider or pharmacist every 6 months. Don't continue taking medications just because they were prescribed. Things may have changed, and your doctor can't remember all their patients, but your pharmacist could be someone that can help you with that. So do check your medications every 6 months. Do a home safety check. Ensure good lighting is very important, particularly on stairs. Take time, move at a pace that is comfortable. I also want to say that don't clutter the house, all right? If there are scattered rugs around that you could fall, remove them. Make sure that you're wearing proper shoes, and we're going to talk a little bit more about that. Eat a well-balanced diet. Even though it says follow Canada's food guide, it's the same thing as the US food guide. You have to get good nutrition. Calcium, vitamin D are important for bone health. Ask your doctor if you're getting enough, okay? The more risk factors a person has, the greater the chances are of falling. So here are 5 things you can do to prevent the fall. Please exercise daily to build strength and improve balance. You'd be surprised, like if you go over to the counter in your kitchen, hold on tightly, lift one leg up, see how well you're balanced or not. There are amazing balance exercises that you could either join in a senior center or you can do it online. Wear safe footwear. Don't run around with socks in the house, especially. Make sure that there's a good grip. Make your home safe, remove clutter, tripping hazards, add railing on all stairs and grab bars in the bathroom. This is important. You should have your bathrooms checked out by an occupational therapist or physiotherapist. Have regular eye checkups. Make sure that you can see properly and that the glasses are clean. Talk to your doctor, the healthcare provider, to learn more about your own personal risk factors. All right, so let's go to the next slide. And remember that I said that your pharmacist is your best friend. You know, pharmacists play a role as part of the interdisciplinary healthcare team for older adults. Their role is crucial in improving the patient's care and life. So for older adults, it can be helpful to develop a relationship with a pharmacist and use the same pharmacist regularly. Please have all your prescription at the same pharmacy because then there won't be any overlap. As pharmacists learn about an individual's unique need and circumstances, they can help provide consistent care and help prevent drug-related problems. Pharmacists are among the most accessible healthcare practitioners. You don't have to make an appointment with them. You can call, you can go over. They can give patients drug information, monitor use, and act as between the doctor and the patient. Additionally, they can provide information on instructions between drugs or other medication, supplements, what food or drinks you should avoid when taking certain medications. You know, I'm repeating myself, but it's important to keep in mind. The average adult over 65 takes between 14 and 18 different prescriptions, medication each year. Pharmacists can educate you on how these medications help with the condition by keeping the communication line open between the two of you is extremely helpful. If we go to the slide now, you know, they can, the one before, the one that we were on. No, go back to, please. Back to the pharmacist. Thank you. As I said, pharmacists can provide individual care. Now, they supply drugs to patients in ways that are physically accessible, easy open bottles or pills without wrappers. I mean, if things are hard for you to do, tell the pharmacist. Having drug labels written in large types, if you can see, and even in the patient's language, so they are easy to read. They can cut pills if they are too large to swallow. Never, ever cut your pills by yourself. It's a big no-no, okay? It is the pharmacist's role to give you the information you need about each of your prescription and how to take them. It's important, again, to use one pharmacist if possible. Next slide, please. Okay, now I'm talking, I could do a whole session on what you need to know about medication when a senior is discharged from hospital. But I wanted to say this, that if you are going to hospital or the person is going to hospital, so before that, I want you to think of all these things. Ensure that you're going to get new medications once you're discharged. Very rarely do they keep the same medications because you went in there for something new that happened. So obviously some of the medications may be changed for sure. So be sure that you get an updated, accurate list of the medications, including everything over the counter that they're prescribing for you. Do not leave the hospital without a list of the new medication. And it should include details such as the medication name, the dosage, the frequency, and most important, the reason why you're taking that medication, especially if it's a new medication, because you want to make sure, new medication, maybe there'll be a side effect. Make sure that you understand the purpose of each medication and how to take it correctly. Discuss potential side effects and what to do if they experience any adverse reactions. So this is just kind of a quick thing to let you know that once you land up in hospital, it's one of the most important things besides physio or whatever is the medications that are going to be prescribed. Let's go to the next session, please. The next slide. Okay, now, if you want to know anything about the medications that you and the person you are caring for, you should go to, it's called Beer's List of Medication. It's on the internet. It's very easy to get. You go on that list and has all the medications by their names, and it gives you whether those medications are at a higher risk for making people dizzy or groggy, especially if the person has dementia. And it's a good thing to monitor because you can then go back to the doctor and the pharmacist and actually say, look, the person I'm caring for is taking this medication and I'm noticing these changes in them. Can this medication be changed so there wouldn't be all that side effects? And so it's a really good resource to go to. Now, the next two slides have to do with the resources, all the things that I looked at and tried to look at all the research. So what I'd like to do now, Minerva, can we go back to the first slide? All the way back? And I've left enough time for any questions that anybody has. And so here I am. If you have any questions, if you have any suggestions, if you had any issues with medications and you found some solutions, please share it with us. It's best when other people share their own experience, which gives other people a lot of more information of how to possibly deal with that situation. So I'm open for questions, suggestions, or anything you'd like to talk about medications.
Hi, this
Kelly,
is,
I see you're unmuted. Go ahead.
yes, I wanted to say, first of all, thank you for this information. I have just had an interesting experience with my husband who has Lewy body dementia and some Parkinson's. And he was diagnosed with Lewy body first. And a lot of times the Parkinson's comes later, and his doctor was insisting that we try a medication for Parkinson's. I won't list what it is. And most of the times the medication works really well. And I was hesitant. I wish I had had this Beers list of medications so I could have done a little bit more lookup, because he also has orthostatic hypertension. So his
Wow.
blood pressure literally in a day is all over the place. Anyway, because of the medication clashes, his hallucinations escalated, his blood pressure was dropped and was really almost bottoming out. Fortunately, I'm very diligent in terms of watching what's going on. So I was able to list out, both for the neurologist and the primary doctor, here's what I see happening. This is what I would like to do, listed everything. And fortunately, the doctors were in agreement, because, you know, we're here every day. They see them once a month at the most. Most of the time it's once every two or 3 months. But I will tell you, just hearing this conversation has been very helpful to me. And also having this Beers list of medications, especially with all the challenges we have with his blood pressure and other autonomic systems. This is just wonderful. So thank you for your time.
Oh, it is my pleasure. I have to tell you, thank you so much for sharing. Just what you said can have an effect on other people that are with us today, but also this is a recording. A lot of people listen to it at a different time. Yeah, I have to tell you, I had the problem with my mom the same way. And I was in the healthcare profession and was really had to think twice in recognizing it's such a difficult thing to manage. But kudos to you that you're taking the time to actually do it. And thank you so much for sharing.
Great job in noticing the difference in your loved one the moment they started taking the new medication. It's something that we sometimes take for granted.
Yep.
And then we realize, even for ourselves, why am I feeling this way? Oh, I've started taking this medication, but it doesn't occur to us until weeks later, sometimes.
What I would say to anyone either taking care of people or themselves, really keep track of when you start a new medication, and anything that you notice, write it down, because we forget and we kind of brush it off, right? And if it repeats, it needs to be something you talk to the doctor about. And again, I have to emphasize, the doctors see our patients maybe once a month. 9 times out of 10, it's every 3 to 6 months. So they're not seeing what we see every single day.
100%. And I have to reinforce again, over-the-counter medications. People don't take it seriously enough. You're not feeling good. There's so many. And I don't know, this is in Canada. I just heard that they're really thinking about removing some of these cold medications off the market because there are so many side effects to them. And we don't think twice about it, or even for pain, I was saying medication comes also as a cream. Some people don't realize that the cream gets into your bloodstream. And so it is very important. What I had to do at the beginning, because my mother had a few, increased in medication, I kept a journal because I couldn't remember everything exactly as you said. And then every time she had a new medication, I kept a journal and saw her, because it's so easy to say, well, it's their dementia. They're behaving like that, it's their dementia. The same thing that we don't know, their behavior changes. It could be medication, but it could be a urinary tract infection.
Yeah.
It could be a pain that they're having and they can't tell us.
Yeah.
So when I say caregiving role, my God, we become doctors, we become nurses, we become housekeepers. It's all the things that go on. But I don't know if you remember in the beginning, I said that the role of a caregiver is so important, apart from everything else that we do, that, like you said, the person you're caring for. You can see the changes. doctors can't when they see them once in a blue moon.
Right.
Thank
And
you.
really, the doctors depend on us. My experience, if you have a good doctor, they're going to listen to that caregiver, right? And most of the doctors now have access to email where you can send them emails. And the other suggestion I would say is, we carry these phones around. I keep his medication journal on my phone because I know I always have it with me. And I just list the date he started so that I remember. So, and anything else. But anyway, thank you again. I'm sorry I've taken up so much.
No, you
Oh,
have
no.
such wonderful your own experience. And so I really appreciate that. Please stay with us. Let's see what else happened or if something pops up again.
I will definitely say, when it comes to the list of medications, if it wasn't for Lucy, I never would have it on my phone. And every time I go to the doctor, of course, they ask you to take your medications, but sometimes you forget the over-the-counter. Now with this day and age, you can have it in your note app in your phone, and you can have the list of all the medications, even the over-the-counter ones. And sometimes you forget. And something that my mom has done is she writes it on a small piece of paper and she puts it in her wallet. So it's always there in case they can't open up her phone. The medications are already in her wallet. So for emergencies, you never know.
No, you
And
don't.
it's always on that last minute when you don't think you're gonna need it that you end up needing it for sure.
So we have
go
a few
ahead.
people. Are there any other questions or comments?
Please go ahead and unmute yourselves, and I'm also gonna go ahead and launch the survey. And this is how we keep track of what your thoughts are on our presentations. If there's anything you want us to try to cover in the future, please go ahead and fill that out. We used to do a survey after the presentation, but we see that this is easier for you. You're here, you remember everything, and you can just go ahead and fill it out. It's just a quick 7 questions. Anyone else have any questions or comments that they would like to share with us?
Give you a few minutes. You can do your survey. We really appreciate those surveys.
I'll make this comment. I was also the caregiver for my mother and my father. And I just didn't have, my husband is a veteran, so I was living with him. I just didn't have enough information for them until I actually moved them here to Texas, where I could lay eyes on them and see what they were doing. The thing is, when you have 2 people that are living together and one has dementia and one is borderline, that borderline one doesn't tell you everything. Right? So if anybody out there is experiencing that, pay very close attention to the pair, because 9 times out of 10, the one that doesn't appear to have many symptoms is slipping. And you need to pay attention to medication. My mother was being medicated incorrectly just because my poor father couldn't keep up with the changes. Doctors change the medicine on a whim.
Yeah.
It's amazing to me how they do that. And I'm like, hold it, wait a minute. We just got on this one. Why are we doing that? But I would say to anyone out there, if you are, or if you are the one that is helping the other one and you have some challenges yourself that you haven't acknowledged, please, please, please reach out to your family or your doctors or somebody, because it really can make the difference basically for life or death for both of you.
And what I also want to say, there are 2 people in this relationship and sometimes 3, and each one of them is as important as the other. So just because you're a caregiver and the person is the one suffering from any form of disease or dementia doesn't mean that you're not important. You are important. You have to take care of yourself. You have to make sure that whatever medications you're taking also are okay. It's easy to fall into that trap of thinking that, well, I'm not going to take time out of my life. They are the ones that need me. But we know from research that it's so important for caregivers not to isolate themselves, to take care of themselves in every respect, physically and mentally, and to gauge their own well-being and the time that they need to have time for themselves. So I just kind of wanted to kind of wrap it up like that, and make sure that all of you are taking care of yourself. I thank you, Kelly. And if we don't have any other questions, please join us again. I think there are some coming up, other sessions by other people. Can you tell us, Minerva?
We will be having some sessions in the month of December. Not as many because we understand with the holidays. But the first one is going to be, if I have the calendar up, I'm sorry.
It would help.
It will definitely help. I know it's Elliot and Lucy, the one that have the first session for December.
We are doing it on stress. I think that's the one we're doing. And
Yes,
Dr. Sklar is an amazing, amazing person. He does a lot of research. And I think we need to talk with caregivers about stress. Yeah. What else is on?
then on the 9th of December, we're gonna have Linda White talking about grief and the holidays. And then on the 18th, we're gonna have Holly Glover talking about communicating with children, adolescents, and families about dementia. I know this was something that was asked for during our caregiver summit. So I'm glad that we already had that in the works for everyone.
Wonderful. All right, everybody. I thank you. Thank you, Kelly, for all that you do and everyone else. Thanks, Minerva, for helping me with my slides.
You're very welcome, Lucy. Thank you so much for this
Bye.
great presentation.
My
I
pleasure.
want to thank the Wellman Charitable Foundation for hosting these for everyone. And if you would like to listen to any of our sessions from the past, you can find us on YouTube or in our Wellman Caregiver Teleconnection.org website.
Thanks again. Bye-bye.
Thank you, everybody. Have a happy holidays.
Yes.